I wanted to bring today's episode to the podcast talking about pelvic floor health. This is something to consider when you're on the fertility journey. If you're dealing with endometriosis, if you have PCOS, maybe you have interstitial cystitis, if you are dealing with any kind of incontinence, even if you've also had a C-section, there could be scar tissue. So I'm excited for you to listen to today's episode on pelvic floor health. And really, there's some simple strategies that you can do at home to really help with this. Take care. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Carolyn Messere to the podcast, and we're digging into pelvic floor health and why this matters when you're trying to conceive. Dr. Messere is a board-certified pelvic floor specialist who now practices functional medicine. She combines these specialties and has developed a program that allows women to improve their pelvic floor function in the comfort of their own homes. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who's on the fertility journey, please share this podcast with them. Hey, Dr. Carolyn, excited to have you on the podcast.
Hi, Sarah. I'm excited to be here.
Awesome. Can you share your journey about really how you came to do this work?
I'd love to. So I started off as a colorectal surgeon.
Yeah.
And, everyone asks, so why would you become a colorectal surgeon? It doesn't seem like a fun job. But what I realized when I was a resident is they were doing all the funnest surgeries, all the best stuff. And I was a diehard surgeon back then. And I wanted to do all those colon resections. And it's funny because what I ended up doing mostly was more pelvic than colon. Because while I liked colon, pelvic was what people send you when you're a beginner. And I got really good at it and I really loved it. And one of the things that happened while I was doing all of that was that people would come to me with pelvic floor pain, urine leakage, fecal incontinence, all those kinds of things that it's hard for them to even talk to somebody. And they were looking for a woman doctor. And I was the only woman doctor at that time in like pretty much all of that area of Florida that I was in. So I started out in Miami, and I was the only woman in all of South Florida. The next closest woman was in Tampa, so four hours away. So people it started off, they just wanted a woman, and what I realized is that what they really needed was somebody who got them, and they weren't finding that. And so I ended up with a huge practice when I was in Miami for 5 years almost. Yeah, 5 years. And I ended up with this huge practice of women that had either pelvic floor pain or had difficulties with, fecal incontinence, those kinds of things. So I ended up seeing a lot of those people. And I also did a really good hemorrhoidectomy. So I was pretty well known for that.
Okay.
So I don't do any more hemorrhoidectomies. I left surgery after 9 years. I was a full-time surgeon for 9 years, mostly for myself, because I was burned out. And they kept telling me things like, if you talk to one more person about nutrition, you're out. I'm like, but that's what people want to talk about. That's what people want to know. If I've got colon cancer and I'm on chemotherapy, should I be eating some particular way while I'm doing that? If I've got pain, should I be eating certain foods? Should I be avoiding certain foods? If I have endometriosis, are there things that I can do with my diet that are going to make it better so I don't need surgery? So those questions came up a lot. And I answered them instead of just going, well, you really should go see so-and-so or do such and such, which is what they wanted me to do. And so I just got to this place where I felt like I wasn't serving my purpose. I knew that I was partly serving my purpose, but it wasn't serving my purpose. And I was pretty burned out and pretty tired. And so I was planning on leaving my practice and starting an irritable bowel syndrome clinic, because those people are also really underserved. And I ended up not having the energy to do it. I was so burned out. I needed a couple of years actually to get myself I was at the time I was overweight. I was borderline diabetic. I was, I wasn't sleeping at night. I was kind of, I think depressed is probably not the right word for it, but I was just not, I had, the biggest thing that I had was decision fatigue. That was like the hardest thing about it. And so I took 2 years off. I worked with somebody and we wrote a course. And I did a lot of research for the course in food. The course was all for people with period problems. So I did a lot of research in food for like, what's the right things to eat for these kind of problems? How do you get that estrogen levels down to where they're supposed to be? How do you get people to produce the right amount of progesterone? How do you teach people not to use up all of their cortisol so that then they have nothing left to make everything else work? And so I spent 2 years doing that. And then I ran into a friend and he said, I could really use you in my office. Do you want to come just do consults? Just hang out in the office and do consults. And so I did. And I started to really love it. And that was almost 4 years ago. And so I've been doing functional medicine ever since. And I didn't know that much about it when I started, but I've learned a lot. And then last year, what I realized is that I wasn't doing one of the things I really loved, which was helping people with pelvic floor issues. And particularly, I worked a lot with people with pain, and I used to do a lot of injections and those sort of things. But I didn't do that much with nutrition because there wasn't much information. Now it's a totally different thing. I can work with people to help them decrease their pain and improve their muscle tone in their pelvic floor. Because one of the things people don't understand about pelvic floor is it actually starts at the diaphragm. It's a whole bowl. Your abdominal cavity is this whole bowl of muscles. So if you're stressed out and your diaphragmatic muscles are tight, which, if you think about it, when we get nervous or upset or we're in a place we're not happy, those are the first muscles to get tight, right? It gets hard to take a deep breath. That's going to tighten up everything else. But then the other thing that happens to people is that they end up with weak muscles in the pelvic floor. So you've got weak spastic muscles in the pelvic floor. And there's a way to correct that for people so that they have a lot less trouble.
Awesome. And so, thanks for sharing your journey here with us. It's an interesting how we come to things and then maybe it's like a little full circle for the thing that we were doing in the beginning. And now how do we
I'm back to doing what I used to do.
Yeah, exactly. Yeah. And so why is pelvic floor health important for fertility?
I think it's important for a number of reasons. One is that the way it all works is that everything's got to get in through that, there has to be, unless you're using some other method, if you're trying to do natural birth, then there has to be a way for everything to get from the cervix up into the ovaries. And if all those muscles are tight, or there's weakness in the floor and the organs collapse a little bit, it is harder to get pregnant. The other thing is that when it's actually time to deliver, no matter how you got pregnant, you need to have that pelvic floor working properly in order to be able to maintain a good delivery. And, it's funny, when I was a medical student, I did 6 weeks worth of OB. And one of the things that I got to do was observe the nurse practitioners, and they do all that massage of the pelvic floor. So they know how it works. Even if the doctors aren't doing that stuff, the nurse practitioners and the nurse midwives are doing that, are working with people to help their pelvic floor do the best that it can. Because what you really don't want to do is tear if you can help it. Mm-hmm. Because those tears, they're, and believe me, I worked with a lot of people that have had those kind of tears. And the worst one is the one that goes straight through the back of the vagina into the rectum. That one's really hard to fix. And usually the person who's fixing it, quite frankly, is a resident. Mm. If you're delivering in a teaching hospital, or it's somebody who's got 3 more babies on the way and they're doing a quickie job. They're just whipping that together. So you don't want to do that. You want to have a delivery where everything stretches and opens and the baby's able to sit in the right position, and everything's relaxed, and the uterus has room in the pelvis, all of that. It's super important to have that all work. And you can start doing that long before you get pregnant.
Okay. Yeah. Okay. So we're supporting couples with low AMH and high FSH and diminished ovarian reserve, premature ovarian insufficiency. In there also, sometimes we have people with endometriosis. So let's talk about, so how would this therapy help with someone with endo, or we also see this too, the interstitial cystitis, pelvic congestion.
Right.
And also PCOS, but how would this therapy help those conditions in particular?
Yeah, it was hard when I was trying to decide who I was going to work with, because I could really work with everybody who has all of those problems. And so definitely people with endometriosis, they have pain. And one of the things that I'm working with when I set this program up, I set my program up so that you could do it at home. Mm-hmm. So that's, I think that's really key to this whole thing, is that for a lot of women, they don't want to go to some doctor and have fingers all in places where they would prefer not to have fingers. And I think that's a big deal for people. I think that, and also that they feel like it's not necessarily helpful. I've seen a lot of people who've gone through, doctor after doctor after doctor, especially with endometriosis, trying to sort out what the problem is. Mm-hmm. So, that there's plenty of things that we can do in functional medicine that's going to help endometriosis. But one of the things that works with what that happens with the pelvic floor is that you get this thing called adenomyosis. And what that is it's actually endometrial tissue that gets in the muscles. So you can get that a lot of women have it in the uterus, but you can also get it in the skeletal muscle of the abdomen. And when you get that, that's going to make that muscle kind of jangly. It spasms, especially when it starts to cycle. And as you also know, with endometriosis, one of the hardest things is that it doesn't necessarily cycle with your cycle. So you can have endometriosis that cycles with your cycle, but you can also have endometriosis that doesn't cycle with your cycle. And so that, having that off cycle pain can be really difficult to deal with as well. So what I'm working with is all the ways to do functional medicine, probably very similar to the kinds of things that you're doing, stress management and diet and those kinds of things. The thing that I'm bringing to it, though, is I'm working with a machine called the High Massager, and it's a tapper. And that tapper, you can use it on the lower abdomen, you can use it across the pubic bone, or you can use it on the perineum. And what that's going to do is it's designed to have an angle that works so that a lot of those, maybe you've seen these ones that the chiropractors sell and it's like it comes down this way. These don't do that. They come in this way. It's more relaxing to the muscle. He designed it. The guy who designed it, he designed it specifically for that. So it's designed to come in at an angle so that it doesn't jar the muscle. And what it helps you to do is relax the muscle, relieve some of that spasm, and then that allows you to be able to strengthen the muscle. Because normally what happens is you end up with this like weak spastic muscle. You try to do Kegels. I know you asked me, one of the questions you wanted to ask me was, why do I think about Kegels? If you try to do Kegels in a muscle that's spastic, it's going to make the spasm worse. So if you get the muscle relaxed, some form of Kegels or muscle strengthening in the pelvis is going to work much better once the muscle's been relaxed. So that's one way to help with people with endometriosis and also with interstitial cystitis, because we don't really know exactly what causes interstitial cystitis, but we definitely know it gets better with diet. It gets better with stress management. It gets better for a lot of people when you treat their estrogen overload. So, but you're still going to end up with that same problem. That bladder sits there in the funnel of the pelvic floor, and the pelvic floor spasms because the bladder's irritated. So again, same thing. And the other thing about the way the tapper's set up is it is set up to go, if you put it right over the pubic bone, the two tappers, one goes over the bladder and one goes over the urethra. And that's going to help to relax that bladder. You start with a really low speed on it, and you do it very short periods of time for people who have those kind of pain. And then you just build up a tolerance to it until it starts to really be able to work for them.
And what about doing this at home? Then if you don't have the tappers, there's methods.
So the tapper's easy to get, actually. So,
oh, it is. Okay.
And not expensive. I was really surprised what he was selling it for. So,
okay.
So I'll have that available on my website. And then I can also give them information about how to figure out how to work with it.
Okay. So you need the tapper along.
It helps to have the tapper. Yeah.
Okay. So it's
not as good to use. There are other, I think that trying to use something like the Kawasaki vibrator, it's too intense. The speed's too high, and it really isn't going to help with that. And it's just got the one head. So that's not, I know a lot of people do use it for that, but it's not as good as this massager that I have.
Okay. And so, and then and so basically all of this is this done at home then using this tapper.
Yep.
And when do we know that we should have this?
If you're having difficulty holding your urine, if you can't jump on the trampoline or do jumping jacks, when you're standing in the back of your exercise class, stepping out your jumping jacks, because if you jump, you're going to leak.
Some of my friends have this problem. They're like, I can't jump on the trampoline anymore. I'm like, what?
That's what happened to me. That's actually what happened to me too. So, so those are, those kinds of things. If you find that you're like having to go to the bathroom 17 times a day, and I mean, I'm not exaggerating that, but a lot of people, they end up, they go to the bathroom, they dribble a little bit out, and then they can't get any more out. And what's happening there is there's spasm in the urethra and the pelvic floor. So again,
that'd be similar to not emptying fully.
Right. So what's happening is they're really not emptying fully. And so then like an hour later, they have the urge to go again, but they still can't get it all out. So this helps with that, to help get that, the spasm down. The other super great thing that I love about this massager is you can use it on your abdomen, and it works on the vagus nerve. Okay. So the vagus nerve helps everything to work, right? It's going to make your bowels empty better. It's going to help. So in order to be able to urinate fully, we actually have to have a relaxed vagus nerve. So the vagus, you have to have an active vagus nerve. So if our vagus nerve isn't working the way that it's supposed to, because we were overstressed, and the autonomic nervous system, which is the fight, flight, freeze, is in charge, it's hard to pee. It's hard to poop. It's hard to digest your food. So if you get that vagus nerve working, that one is, rest, digest, reproduce. So we need that vagus nerve. So one of the nice things about this massager is you can also use it way up here where it starts at the diaphragm, and work your way. You can use it as like, you start at the bottom of the ribs, and you just keep moving it down until you get down to just above the pubic bone. And that also is going to help get things relaxed in the abdomen, and it helps the vagus nerve to work better.
And then also, so if you have endo, if you have PCOS, though, like that's kind of like a no-brainer that you'd need to look at this.
I think they have to try it out. I think for some people, in the beginning, the tapper might be too much. And I definitely can teach people some techniques using their hands to do similar massage, just to get them started so that they get to a place where they're able to do that.
Okay. And then is it anyone on the fertility journey, or it's really those specific cases then?
I would say that everyone who's planning on having a vaginal delivery should think about making sure that their pelvic floor is in top shape.
Mm-hmm. Mm-hmm. Okay.
So do they need it as much as somebody who has endometriosis? Probably not. But, could they benefit from it? Absolutely.
And so like a pelvic floor examination, what does that look like?
You mean if you go to the doctors?
Yeah. So like if someone wanted to see a specialist, kind of like, I guess they're like pelvic floor physiotherapists and things like that.
There's people who specialize in that. There's physical therapists who are very well trained in it. I worked with several really good ones when I was working as a surgeon. And so what's going to happen is that they're going to want you to take everything off for similar to how you have a vaginal exam before you're having, before you can do anything. So they're going to feel first thing first is they're going to do a pelvic exam similar to what you would have done when you go to the gynecologist. The hard thing is for a lot of people is that what they'd like to do also is a rectal exam. So, because one of the easiest ways to access the pelvic floor is through the rectum. The vagina is not the best way to get to it because it's designed to be to sit in a certain way and have the uterus sitting above it. But the rectum, you can actually, because it's fairly flexible, you can actually feel the whole pelvic floor. Maybe not quite. You can feel around the edges of the vagina on both sides, and you can feel all the way down to the tailbone. So you can get a really good sense of what's going on with it. So just to be prepared for that, they are going to probably want to do a rectal exam. And if you go to the physical therapist, they probably will do some, they'll use the rectum for ways to get access to those muscles. What's nice about like the machine that I'm working with is you can do it with your clothes on. There's nothing goes in anywhere. So
What about if someone is dealing with secondary infertility and they've had a C-section, so they could have scar tissue? How would that impact things?
Same. It's going to be really helpful for breaking up that scar tissue, and it will do that also for endometriosis. So both of those things. I mean, if you do, I think abdominal massage. I started long before I had the tapper. I trained in abdominal massage. And there's a guy in Thailand. I think he's actually Chinese, but he left China and he's in Thailand. And he teaches something called Chine Song. Mm-hmm. So it's a Taoist version of abdominal massage. A lot of people know about the Mayan abdominal massage. This is not quite the same. It's not that different, but it's not quite the same. And he also has a technique called the Karse Nesang, and that one's through the rectum, through the vagina. So those are things that I trained in even before I learned about this machine. And so those are all things that are available to people. It is not easy necessarily to find practitioners who do those things, but there are, particularly, I think in Northern California, there's people. I believe there's a few in the Ontario area. So there's a few in Canada. It's not like there's none. There's one other one besides me here in Florida who's trained in that. So there's ways to find those kinds of people that do those kinds of things if that's more what's needed.
I think a lot of people have heard about the Mayan massage. I don't think I haven't heard of the Thai fellow.
Yeah. So yeah, it was actually it's been a really interesting journey to learn how to do the abdominal massage. But even just for myself, it was great to be able to do it because there is a technique to use on your own abdomen.
And what about so if we can go into some of those the manual therapies, like what are these techniques?
So the biggest one that I really love is just to do little cats. We call it cat's paws. You're just kind of moving your fingers over the abdomen in all the places, all the way. You start up in the right upper quadrant and you can work your way all the way around. Just kind of really what that's doing is relaxing the superficial muscles in the abdomen because those guys will keep you out. They're usually pretty tight in most people. And then of course, if people have a diastasis, they can still get into that space around the diastasis and do little cat's paws down that as well. Because that's
what's a diastasis?
Oh, sorry. After you deliver a baby, a lot of times the two muscles in the abdomen separate.
Okay.
And they don't always go back together again. And it's not necessarily from a C-section. It can happen during a normal delivery. So you just start with like that cat's paws. And then if you want to go a little bit deeper, if you feel comfortable doing it, usually I have people start in the right lower quadrant. That's where the colon starts. And then you just trace the colon up along the right side of the abdomen, across the middle, and then down to the bottom. And that's, if you just very gently follow along where the colon is and go in the direction that the colon empties in, that's going to help that colon to do a better job of emptying. So people who are constipated, it helps with that, but it also helps people who have like chronic diarrhea, because their muscles are, it's that same thing that the pelvic floor is doing. The muscles are jangly or spastic. So if you massage those muscles and you do it every day, it takes 5 minutes. It's not something you have to do for an hour every day. So you just do little cat's paws for maybe 2 minutes, and then you follow that colon around. It's going to make a big difference for people. And it starts to begin to move things in the right direction.
What kind of pressure are we putting when we're doing that?
Very light pressure, just enough. Like what should happen is that for most people, they can feel the difference between when they're on the colon and when they're off of the colon. The colon kind of has it's like a little gas bag kind of thing. Like you can feel that little bit of air. And for most people, they can feel it too, because it'll start to move. The air will start to move through the colon when you start to massage it.
Never really felt any of that.
I know, never really thought about it.
Okay. And so what about, the diet and lifestyle suggestions that can help pelvic floor? We probably do similar to you with elimination diets and more to reduce the inflammation. So what are you using?
Yeah, I mean, that's basically what I'm doing too, is elimination diet, low dairy or no dairy at all, gluten-free. I love a good grain-free diet if I can talk people into it, because grains are inflammatory. And one of the biggest problems that we have with grains is that they're high in omega-6 oils, which are the pro-inflammatory oils. And they sit around a lot. If you're eating, the worst thing is, it's so upsetting. Whole grains have oil in them. They sit around and they get rancid. And you'll notice, so, you open that container of oatmeal or that container of whatever cereal it is, and it has a smell. And they try to convince us it doesn't mean anything, but it's rancid. It's not, it's high, it's high in oxidate. It's been oxidated, so then you need like a lot of antioxidants to kind of fight that off. So I'm not a big fan of grains, especially for people when they first start working with me. I do eventually get them into some grains like rice and oats, but I try to stay away from barley and wheat and corn, because those are probably the most inflammatory ones. I have them eat a lot of omega-3s. So for me, I like a good fish oil. I'm really cautious about using fish oils that come from CVS or Walmart. They're not good quality. And again, they've been sitting on the shelf going rancid. So I like, one of the brands I like is Wild Foods. I don't know if that one's available in Canada. And then there's a couple of other brands that are also good. I'm trying to think. There's one, Nordic Naturals.
Yeah,
Nordic Naturals is pretty good. What you want is fish oil that comes from small fish. The bigger the fish, the more the mercury. So, and then that's another issue for people, is looking at their mercury levels and those kinds of things. I usually do that later. I don't do that initially, because the first thing you have to do is get people to actually be digesting their food and draining, getting the liver working the way that it's supposed to work, getting the bladder and the bowels to work the way that they're meant to work. So that's where I usually start. And then we work on if there's more detoxification that needs to happen.
And so, so you talked a little bit about Kegels. Anything else you wanted to go into there with that? Just more that
I really just want to caution people. Yeah, I know. I really want to caution people that Kegels are not necessarily, especially doing them without the instructions of a physician or a physical therapist. And then the other thing to watch out for is there's some like little machines you can buy on Amazon, or sometimes even I've seen them in the drugstore, that you want to be careful with those kinds of things, because again, they might increase your spasm without giving you the strengthening that you're looking for. So, and I can't say everybody has that spasm weakness in the pelvic floor, but if they have any of the symptoms that we talked about, they probably do. Mm-hmm. Or if they just delivered a baby, sometime in the last year, they probably have that.
Awesome. Okay. And then what about like some deep breathing and things like that of how that can help?
Yep, absolutely. That's always going to help. Like I said, that the abdomen is a whole bowl, right? It starts up at the diaphragm and it goes all the way down to the pelvic floor. So that deep breathing is going to help to relax the upper part of the abdomen, which is then going to allow the bottom part of the abdomen to relax. It also is going to get that vagus nerve working better so that you're in more of that relaxed zone, so that your body's going to be more willing to get pregnant. We've definitely seen that if you did absolutely nothing else and you worked with the vagus nerve in women, not the women that you work with, because I know those women have like lab verified significant fertility issues, but average women who like it's taken them more than a year to get pregnant, it could be as simple a thing as doing some deep breathing and getting that vagus nerve working so that the body knows that it's safe.
Mm-hmm. Yeah, reducing inflammation, getting the out of the fight or flight, all of that is so key.
Yeah.
Okay, are there any resources that you would like to share with us?
Well, I'm definitely going to make a free gift available to you. And the two things I'll definitely, what I want to do is set you up with an infographic that's going to tell you whether you might benefit from some pelvic floor work, and also whether it's going to be the kind of thing that you could do at home versus you probably need to go see a doctor and have it really looked at. So I'm going to create, I have that available for people so that they can just look through that and see where do I fit on the scale. And then the other thing is a guided imagery for people that goes along with, I'll give you the instructions for how to do that little bit of massage. So the guided imagery kind of goes along with that. It teaches them how to do that with also some suggestions for how to tell your body everything's okay. It's all right to be, you're safe. Everything's working the way that it's meant to.
Nice. Okay, so we'll have those links in the show notes. Any success stories you'd like to share with us?
Well, I could share my own,
Sure.
which is interesting because I never had any kids, but I was a surgeon. So I stood in the OR for hours and hours and hours, and I held my bladder. Plus, there was just a lot of pressure on my pelvis because, we didn't have, sometimes you'd be in a position where you just couldn't move out of that position for an hour or two. We'd try to get somebody to take over for you for a few minutes just to get, a chance to relax a little bit. So what I noticed was that I was starting to have more frequent need to go to the bathroom, waking up in the middle of the night, that kind of thing. And then I went with a bunch of girlfriends. We went to a trampoline place and I could not do that.
Oh.
And I was really shocked because, I always thought of that as something that happens to women who've had babies, but it happened to me anyways. And so for a long time, I just avoided, jumping jacks and trampolines and those kinds of things. And then when I started working with the high massager, I've had one for, I guess, 3 years now. I think I got it in 2018 and I work with it pretty consistently. And what I noticed was someone suggested to me, I was having some trouble with ankle swelling. And someone suggested to me that I get a rebounder. And I was like, oh, no, I'm not doing that. And so she let me try hers. And I was like, hey, no leakage, not even any urgency, not even a little. So definitely, I definitely think when you get that pelvic floor relaxed and then allow it to strengthen, it'll pretty much strengthen itself. You don't really have to do that much. So, but I was pretty surprised that it worked, but it did.
Awesome. Yeah, to get it out of that kind of like spasm, and we don't even really know what it is. I guess the symptoms would be, yeah, like we talked about, if you've got the urinary incontinence or what else, just to recap the symptoms that people know.
Well, I mean, some people have pain. There's no question about that. And it may be mild pain that only happens when they when they stand in certain positions or sit in certain positions, or it can be quite severe pain where it feels all the time like they're sitting on, people have described it like they're sitting on a pine cone, or they're sitting on, there's something like stuck up there. They can describe that kind of pain. They can have difficulty, like I said, with urine. They might have some difficulty holding their bowel movements. And the urine thing, it's interesting because both the urgency and the leakage are kind of even though they're considered two separate things, they're the same kind of problem. It's a spasm and a poor control of the muscles in the pelvic floor.
Mm-hmm. Mm-hmm. Great. Well, any final thoughts on our topic today?
I guess my biggest final thought would be that I think if you've been thinking about it, but you haven't wanted to go to the doctor, think about doing some kind of an at-home program like this.
Mm-hmm. I love it. Great. Well, thanks for shedding some light on this first. I think it's a topic that's not really talked about a lot. And I think people are like suffering in silence with these sort of things. And if obviously on the fertility journey, if you're dealing with, endometriosis, endometriosis, oh my goodness, endo, we'll call it, endo or PCOS or the, I won't be able to say that either. God, just please edit this, interstitial cystitis, and more. This could be a good method to consider. So thanks again, Carolyn, for coming on.
Thanks, Sarah. It was great to talk to you.